Hi, good morning.
Everyone, thanks for joining us right on time. We'll get started in just 2 minutes. If you want to put in the chat box, maybe something that you're hoping to get out of this session. And if you want to remember just throughout to put your comments or questions in the chat box or the Q&A.
Hi, good morning, everyone. Thank you for joining this session. My name is Soledad Tillman. I am the Strength and Families Coordinator with Prevent Child Abuse Georgia. I'm really excited to introduce our presenters for this session. Cheryl Galloway-Benefield is with the Mental Health and Wellbeing Coordinator. She's the Mental Health and Wellbeing Coordinator with the Georgia Department of Education, and also Dr. Angie Boy, a Program Manager and Prevention and Training at the Stephanie V. Blank Center for Safe and Healthy Children, the Children Healthcare of Atlanta. Thank you so much for joining, and I hope you enjoy this session.
Hey, good morning, everybody. Cheryl and I are going to tag team the presentation, and so we hope that you can really get concrete tips that you can walk away with that will help as we sort of plan for next time something like the COVID-19 pandemic hits. So we're going to talk first about what we have seen, the impact of the pandemic on kids. And I'll say up front that it's not all negative. And I think that's important for us to remember, is that not all of the impacts were negative. We tend to over-focus on that, and it is important to focus on the negative impacts. But it's also important to realize that for some kids, the dedicated time at home and the dedicated time with their families was really good for them. We're going to look at what the historical role of schools has been and sort of what the role of schools in our communities are today. And then we'll talk about diversifying the village concept. It really, one of the things the pandemic has taught us is that it really does take a village to survive, but we need to diversify what we are thinking about when we talk about the village. And then what are some concrete things we can do now to plan for next time, because there will be a next time, whether it's a pandemic or something like a natural disaster. There's always a next time. And so how do we plan for that? So what we do know is that an increase in isolation may increase a child's risk for stress, trauma, and even abuse. Doesn't mean it will. So that's important to keep in mind, and that's important to have in the back of your head as we're going through this. We know that it may increase a child's risk, but it's not definitive that it will increase the risk. We know that children are most often abused by family, caregivers, and people in authority over them. So when they are kids who may be at risk are then isolated in our home, that risk for being physically abused may go up. We know that isolation increases stress. We can think about how we responded in the immediate aftermath of figuring out what this pandemic meant. We were all staying home. We may have been isolated from our support systems, and that led to stress. Some adults may take that stress out on the most vulnerable around them, and that generally includes children. We know that when they are isolated and when they were at home, they were online more, doing online schooling. You know, mom and dad were having to work, so the kids may have had unsupervised internet time, and they are more likely then to be exposed to pornography and online predators. Rest assured that because they were home alone did not mean perpetrators quit using their online sources to reach out to kids. They had greater access to kids because more kids were online. The length of this pandemic may compound already toxic environments. So you may have had families who already were under a large amount of stress for a variety of different reasons. And now the pandemic has just added more stress to them and may have reduced or eliminated some of their support systems. So they're already experiencing a lot of risk factors that now are made even greater. So all of this combined leads to an increase in risk for abuse and trauma. The increased risk doesn't necessarily mean that there's an increase in physical abuse and sexual abuse. So we've seen some increases, but the data really contradicts, and we'll talk about that in just a minute. We know during the last economic recession that rates of abusive head trauma increased in kids between that 2004-2009 timeframe, and it doubled in children 2 years and old and younger. So those financial stressors lead to other stress within the family, within the household, and so you will see increases in physical abuse. For every 1% increase in the 90-day mortgage delinquency rate, there was a 3% annual increase in the rate of child abuse requiring hospital admission. And then there was a 5% increase in the rate of traumatic brain injury suspected to be caused by child abuse. Now, the data is not out yet on how mortgage delinquency during the pandemic has impacted any of this. These are much longer studies than we've had time to assess. And so I think we'll see some similarities, but it's going to be hard to know for several more years to see what the true impact financial situations in the pandemic had on kids. We do know in some studies that have been done talking directly to parents and getting their impact, their opinion on how they've been parenting during the pandemic, a majority said that financial concerns and the social isolation are getting in the way of their parenting. About 20% said they had spanked or slapped their child or children at least once in the past 2 weeks, and 12% had a few times or more. So the increased stress of the pandemic is leading them to increase their use of physical punishment. Then the rates of shouting, yelling, and screaming at children are high, with 40% of parents saying they had done this a few times or more in the past 2 weeks. And so, I think we can all think about the experiences we've had, those of you who are parents, and tried to balance working at home and overseeing school and, people pulling from all sides. You can see where if you already don't have great coping skills, great, parenting skills, and that it can lead to an increased risk for using harsher treatment with your kids. We do know that large numbers of kids were cut off from their safety nets, so these schools and youth-serving organizations. In March of 2020, reports of suspected abuse and neglect decreased approximately 50% after schools and child and youth-serving organizations closed. But overall in 2020, referrals for abuse were lower, but substantiation rates were higher. So the abuse that was being identified were the more extreme cases. Rates of reporting have rebounded, but aren't entirely back to pre-pandemic levels, and that might not be an entirely bad thing. It may be that families have gotten supports in place. They have figured out support structures. It may be that we've got better recognition of cases that are neglect due to poverty or other concerns as opposed to willful neglect in parenting. And instead of referring to DFACs, we're making referrals for family supports within the community. We do know that again, parents have said they're yelling or screaming more, and they've increased their use of discipline. So one of the very first studies that came out during the initial months of the pandemic, researchers found a significant increase in physical abuse cases. The issue with this is that it was a very small study, one hospital in Baltimore that did not even see all of the pediatric cases in the city of Baltimore. And so it was really small, and that hasn't been completely replicated nationally. There has been some information looking at national data that shows an increase, but how significant that increase is, whether that increase is significant, is still up for debate, and whether or not it truly led to an increase in physical abuse. We did a study here looking at our data, comparing a set of weeks in 2020 with those corresponding weeks in 2018 and 2019. And we found that even though pediatric visits to the ED and child abuse visits to the ED declined, the number of child abuse-related visits due to neglect from inadequate supervision increased by 62%. That's what we saw here at Children's. It wasn't an increase in physical abuse. It wasn't an increase in sexual abuse. It was an increase in neglect referrals because the adults weren't able to adequately supervise their kids, and that led to injury. And sometimes these were injuries severe enough to need the intensive care unit. The injuries generally fell into falls and injuries related to falls or overdoses, both intentional and unintentional overdoses on drugs that kids found. So we also know that the number of visits per 1,000 pediatric ED visits increased. So what we see and what we saw here was an increase in the rates due to inadequate supervision. So it wasn't that parents were physically abusing their kids, it's that parents were trying to balance working at home or having to go to work, and there was nobody that they could rely on to watch their child, so they had to leave kids at home who might be too young to be left at home alone, and there was an injury that occurred. But we saw as many injuries in families where the scenario was those parents were working at home and nobody was watching the children. And so these are our younger kids being injured, finding medications, things like that. So it's not, these injuries were not relegated just to families who may have been working outside the home. So I'm going to turn it over to Cheryl to talk about the historical role of schools and what the role of schools in our community are right now. And Cheryl, you're muted.
There's always going to be somebody in a meeting, right? May as well be me. So good morning, everybody. Let's talk a little bit about the role of schools and what that's looked like historically. In many cases, the school or the school district is a trusted community resource of health information, safety information, physical safety. It's where our students may find mental health resources and connection to other sources of help. And a lot of times there's a sense of community and belonging at school that they just can't find anywhere else. In some of our more rural locations or in smaller communities, the school may be the only source of info and resources in that area. So when schools started shutting down for COVID, not only did we lose a referral source for children who may be being abused or neglected, but many of our children lost their access to resources and supports that were found in the schools. So if you would, take a minute to enter into the chat. What roles should schools play in our communities? And this is from your perspective. There's no right or wrong answer. Just what roles do you think schools should play in our communities? Education, a safe place to learn and grow, support, education, socialization, resources, social support, resources, advocacy, a safe haven, liaisons, health and nutrition, safety net, development of the whole child, not just academics, family support, education and safety, education, socialization, support, community connector, good, love and acceptance, education, socialization, resource sharing, teams, safety and education, trusted adults for children and youth, safety and support, education advocate, safety, role modeling, safety net planning, connecting families to community resources, supporting the family and the student as a whole, academic support, education. Okay, those are good. A home away from home, I like that. So let's look at what role schools do play. Primarily, the function of schools, legislatively and in many of the ways that schools are measured, most of the ways schools are measured, academic instruction is what they do, and career guidance. There's a lot of focus on academic instruction and career guidance, particularly as our students move into middle and high school. But schools also provide medical care through school nurses or school-based health centers where they may be, food service through our nutrition departments in the schools. And we're extremely happy to see that the free and reduced lunch benefits for breakfast and lunch were extended again through this year for all students. Counseling, whether it's a mental health professional or a school counselor or whomever may be on site, social service navigation, and child protection. These are some of the things that schools do, and we know that they do. But let's take a look at something else. These things, the medical care, food service, counseling, and social service navigation and child protection, are not as well supported in schools as we might think sometimes. While these are the things that are often most important, and when schools shut down due to COVID, I can tell you that very few calls to my office were about where's my child's math instruction, where's the homework. The calls were about those things, the medical access, the nutrition, and things of that nature. So when we think about that, let's look at our school support staff ratios. School counselors on a national average are staffed at 1 to 250. In Georgia, it's 1 to 408. School social workers nationally are 1 to 250. And for students who need intensive supports, they're staffed at 1 to 50 students. In Georgia, the school social worker average is 1 to every 2,633 students. School nurses, we don't know the national average of school nurses, but we do know that in Georgia, it's 1 to every 1,073 students. So when we look back and think back at the roles that we know schools are playing and what was missed when we closed schools for COVID, who should be in the village? If it takes a community to fill those gaps that schools are not funded to provide or don't have the staff to provide, and we know they lost those things, who should be in the village? And by village, we mean the larger community. Who should be there to help fill those places where there aren't those positions available or there aren't those supports available in the schools? More mental health providers in the community. That was one of the things. We did get calls about that. We got calls about, and there was a lot of concern and a lot of public focus on a lot of things. Affordable mental health, more advocacy. Police, neighbors, youth serving agencies, mental health and advocacy. Bilingual providers, mentoring. Yeah, teachers are being asked to be the mental health providers. Mental health for young children, school social workers, mental health and advocates in general, counselors, church outreach groups, low income to free healthcare providers. Yes, community center and activist groups. Okay, school social workers, mentoring groups and organizations, local governments, social workers and mentors, community programs. Okay. More social workers, yeah, medical providers. Libraries, churches, community outreaches, and available relatives, food banks, tech companies, affordable access to technology. Yeah. Various support groups, right? Clothes closets can be very important. Churches. We see our faith-based community, particularly in some of our smaller areas, being critical to the supports that are available. Collaborative resource teams, private practitioners. Right. A lot of good answers there. So when we actually look at who's in the village, that depends on where that village is. And there are a lot of variables at play. It depends on whether the community is urban, suburban, or rural, whether it's wealthy or middle class, working class, or a very high poverty area, and whether the community is more highly educated, less educated, or there's a high dropout rate among community members, and whether there is family in the area or no family nearby. So we know that most communities have some similar organizations or facilities. Most communities have religious organizations of some sort. Most communities have schools. Now, in large rural counties, there may be one school or a middle school, elementary school, and a high school in the district or in the county, but that county may be 250 square miles. So where those three schools are located, and they're usually located in the same town in that county, that still can be really not accessible outside, given the broad scope and the lack of public transportation. We know that there are childcare options often, but they can look very different depending on the variables we talked about above. And we know that there's often a parks and recreation department in most counties. No matter where you are, there's often a parks and rec. But who should be there? I'm sorry, go ahead, Angie. Was that, I'm sorry, I thought you said.
I had accidentally hit it and gone backwards.
Okay. So we know that those are things that most places have, but where they are and what's available totally depends on the variables in the village and in that community. And the variables in that community and what's available impact how those schools are able to proceed and what they're able to do. Angie?
Okay. And so we're going to talk about really diversifying that village concept. And part of that is encompassed in that, what about next time? So think about as we go through these next slides, think about those examples that you guys brought up in the who should be in the village question. And you guys had a lot of really good examples. But if we have that next time where, schools are closed, or, kids are prevented from being in the traditional school building for a certain amount of time, what else can we utilize within our village? And think about just the things that you may have seen organically come up in your communities to meet the needs of kids and families within your communities. So these four are the things that we're going to talk about, but there are other things that you can include in sort of planning for next time. And what you decide as a community is going to be different than what somebody in Atlanta decides. That if you live in a more rural area, your next time may look different. If you live in the communities down in Southeast and Southwest Georgia, you've seen the impacts of natural disasters just in the last 3 or 4 years that have had a significant impact on your communities. That is part of that planning for next time. So what are you thinking about in terms of your community? Sit down and make a list of who's in your community. What resources do you already know exist? Some of the questions you can ask. Who in your community currently works with families? And think about, okay, yeah, the school is there, but are there services provided for young parents or new parents at the local hospital? what daycares are available, what church programs are available, who runs the local Parks and Rec department, where do kids play T-ball. So start making a list of who is available and who's currently working with families in your community, and then start asking yourself, okay, do I know these people? Do we already work together on other projects? Or are we all kind of siloed? We meet the needs of our clients and the people we work with, and they handle their thing, and we don't really work together. Sort of think about that and really assess, well, how could we, if we're all working in silos, could we break that silo apart and work together? And, really our work complements what other organizations are doing. We're not in competition. We want to complement what other organizations are doing. Then really look at what resources are available in your community. Do you know where all of the food banks are? Do you know if there's a clothes closet? If not, are there resources available to start one? What can we think about? What are we already doing that we don't realize is already being done? And then look at what gaps in services exist. So maybe there's not a food bank. Maybe there's not a clothes closet. Could the faith groups get together and they rotate, and each one has a food bank on any given Saturday, where all the Saturdays in a month are covered? Or, do we open a clothes closet at the local high school that families can access? What kinds of things, what resources do we have that we could make available to fill those gaps? Now, it may be that you realize there's a gap in service and there isn't a way in your local community to meet that need. That's reality in a lot of our more rural communities. So where is the next closest service? And you really make sure that you have those available so you can refer your families when that's needed. And most people are already doing that. But then does that mean we need to advocate more for those community services at the legislative level, both state and federal? Hey, we need some funding for this because this needs to be offered in our community. One of the big ways we're seeing that right now is in technology, and we're going to talk about that next, the sort of infrastructure and I call it people structure, because there are physical infrastructure that we need. I was listening to a news story about this just yesterday around that last mile internet use. And there are pockets in this country that do not have access to internet. Not that they don't have access to broadband or fast internet, they don't have access to the internet at all. And this one particular woman that they were interviewing from a Native American reservation in Nebraska, I think it was Nebraska, they go an hour and a half away and they get a night in a hotel, so they have access to Wi-Fi. Her phone updates, and you could hear it as they were interviewing, you could hear the pings of things updating on her phone. But, I mean, you think about how often you update your phone or how often an app may update on your phone, and she doesn't get that. So if you don't have solid internet in your community, that means your families can't access online education. So kids may get behind in education. They can't do remote school because it's physically not possible. But then families without internet access, good quality internet access, also don't have access to job searches online. They don't have access to maybe job training supports that they could get available online. They don't have access to complete a job application. They can't look for a job, they can't apply for a job, they can't further their education online because they don't have that internet access. And in this particular Native American community, they don't have it at the library either. So it's not always just a matter of you don't have it in your family and in your household, but you also don't have it in the community at all. So really looking at those infrastructure improvements that are needed. What other resources aren't available, whether it's transportation or childcare, and that gets into the people structure as well. But these physical resources aren't available. And then how do you deal with supply chain disruption? and we see some of that in natural disasters, just like we do in the pandemic, when nobody could find toilet paper and, there's some supply chain issues. But then if you don't have electricity because your power grid has gone offline, because all 5 transformers that feed the entire community are all in one place, which is what happened in New Orleans. And most recently with Ida, you lost 2 entire parishes because all of those transformers were in the same place. They'd wanted to make improvements, but they hadn't had the dedicated funding. So how do those disruptions then impact whether or not you can get resources, physical needs into your community? So then looking at the people structure and the other things we need to think about. How do you provide childcare? I organically saw a church down the street from me open for remote. They would oversee children's remote learning and provide a safe place for kids to be cared for while their parents had to physically go to work. I was fortunate that I had family support and didn't have to do that, but other families did. They were full, and so they met that need, but it was only met for people who could afford it. And so again, you've got those affordable childcare issues. Our public health infrastructure is outdated and underfunded. That is true nationally. It's specifically true in Georgia. Dr. Cheney just mentioned it yesterday in a press conference, that they need more funding, and a lot of their systems are outdated. So, there are those issues around the people structure. Same thing Cheryl mentioned with schools. Our school professionals are overworked. Our classroom sizes are continuing to grow. Our social workers and counselors and school nurses are overwhelmed and overworked, and we don't have the physical capacity to add more right now. There's no funding. We have to work for better education at the university levels to get additional social workers and counselors, so we actually physically have the people to do the work. And then remote work options are not universal. So what do we do in our communities for those employees who can't work remotely? Nurses and physicians, telehealth is great, but you still need somebody in the emergency department and in labor and delivery to deliver the baby, and in the operating room. You need people stocking grocery store shelves. You need the trash man to come pick up your garbage and provide sanitation on a weekly basis. There are lots of people who cannot work remotely, but they may have kids. And so what do? And how do we provide resources to those families when that next time comes along? So these are the kinds of things we need to be thinking about now so we can help our families later. Because this is getting at reducing that stress on our families. Did somebody have a question?
Yeah, it's me, Angie. I was going to ask if I could just interject right here for just a minute. So one thing I want to make sure that we point out right here, the title of our presentation is When the Village Falls Apart. And that was really, it was focused on the fact that when schools shut down, it was all of these things that people were scrambling to figure out how to fix. So I think it's super critical right now that while everything is kind of leveling out as much as possible, before we forget the lessons, let's make sure we write them down. Let's make sure that we capture what happened, what was missing, what did we lose access to, and how do we keep a record of that and start preparing. We've worked with districts in natural disasters prior to COVID where the school buildings were so damaged that they could no longer function as that place that they had been, or where the staff was so disrupted because they lost their homes. They had injury and deaths, and so they couldn't be there. So we had these pockets of things that happened prior to COVID, but we didn't create universal lessons from them. We have an opportunity right now to create some universal lessons and to work with our community so that we identify if schools are the hub, and I am a whole child advocate. I am a proponent of everything that is not academic all of those barriers to learning that impact our students, those are the things that my work is focused on. So those were the things that many people were initially and for the long term truly concerned about. So how do we capture this point in time? How do we look at what did we do? What were we able to do? What do we need to plan for in the future at the school and the community level, and bring those people to the table together so that you can start figuring out in your community, what do we do if the school is not there? And what do we do if community resources, how do we work together? I think, Angie, that kind of is in a nutshell where all of this is going that we're talking about, right? Is using this momentum now. And we're going to get to that in the next slide. I know we're going to start talking more about that.
Mm-hmm. It really is, how do we connect our families now? How do we identify what's already in our communities and what ways can we connect them? And family resource centers are being identified as a way to help. And there's a good bit of funding that is coming out that support the development of these family resource centers. And so what these are doing is, in a community, they're putting a lot of things into one central location. So you could have a parent come in who wants a support group. They just need to hear they're not alone, that it's normal for them to be struggling with the stressors of being a parent. Because let's face it, parenting is hard. Parenting in a pandemic is really hard. And so how do we support our families? And so these family resource centers are a good way. And these are things that are already established and are being established more and more in our communities. So you can have one family that comes in and they need a support group or they need parenting classes. Then you've got somebody else who needs help finding housing, or they've lost their job and they really want to access job-seeking resources. All of that's in one place. And some family resource centers are, have the ability to take care of the kids while mom or dad, or the caregiver is working on what they need to work on. So you've got that childcare provided, because that's a barrier for a lot of families in accessing services. Is what do they do with the kids? We saw some of that even at Children's when we had our policies, rightly so, restricting the number of people who could come to a visit. If you have a mom needing to bring one child, but she's got 3 other kids that she can't leave at home, how does she get to that medical appointment if she doesn't have childcare for the other 3? So we saw some issues with that of, what do you do? How do you handle that? So those are the kinds of things that family resource centers provide. And the goal is to mitigate the stressors that parents face and to meet these needs before Child Protective Services ever knocks on the door. So you're meeting these needs, you're reducing the family stress to then in turn reduce the need for Child Protective Services. Cheryl, I'm going to let you touch on the partnership between DFACS and DOE.
Right. So we recently hosted a webinar, DFACS and Department of Education did, to bring awareness to schools and to make them aware of a funding source that DFACS has available to establish family resource centers for school districts. And we have that webinar recording. I'm going to drop the link in chat so that you can go back and view the webinar. It was open to the public. We had a large number of school districts who attended. But I'll be happy to post that link so you can go back to your school district and perhaps have a conversation about what are we doing to establish a family resource center in our district or in our schools.
So again, we're already starting those partnerships, and these are the things that are already being done. So how can we capitalize on that and really help our communities? So we did want to end with some resources for families and that you can take and share with families that you serve. Strong for Life, which is a program at Children's that began as an obesity prevention program, and they still have that focus, but they've also expanded their offerings to really look at a wide variety of issues that parents may face. And so they've really strengthened their emotional wellness and resilience resources. So they have, ways you can talk to kids about death. They've got a big section on resilience. How do you parent with challenging behaviors? So these are tips from experts. It's just a good landing page for parents. So the website is at the top. And then Cheryl, you can talk about the Office of Whole Child Support.
Yeah, so in the Office of Whole Child Supports, we truly do address all of the non-academic barriers to learning. Under my shop in mental health and well-being, we are the people who really try to work with schools on suicide prevention, substance abuse, gang awareness, human trafficking, mandated reporting, and child protection. Everything of that nature sits with me. Integrated wellness, that is the physical side of child well-being. Staff wellness, physical health programs, school nurses, health barriers to learning and development, those sit with Mary Lauren Salvatore. She's the coordinator for those. And for the physical side of school safety, which is what people most often think of when they think of school safety, it's emergency operations planning and response, the school safety hotline, student discipline, bullying, unsafe school choice, things of that nature sit there. We do have the wraparound support services in our unit as well. And we have a new whole child model school certification that's being piloted this year in, I believe, 4 areas. Where schools are working to become certified as whole child model schools. And it includes a lot of the things we've talked about today. And I believe they're working on including family resource centers or starting the planning for family resource centers in those pilot schools. The Georgia Student Health Survey and Student Wellness Survey sits in our office as well. And we do have a whole child toolkit. So there's a lot of information there. You can click on the links on our page to go out to the different pages associated with all of these topics. But we have links to resources, links to training, and certainly anytime you have a question or want to talk about any of these things that fall under our office, you can absolutely reach out to us and we'll be happy to have a conversation or see what we can do to support the schools in your area.
You other resources, these are ones that we try and put anytime we're doing presentations where we know people may be going back and working with families. Getting the Georgia Crisis and Access Line out is important. We know families have mental health issues and they need that support in the midst of crisis. So you can reach out. It's operated 24/7. So it is definitely, when you have a mobile, have an emergency, there is the opportunity to have a mobile unit dispatched, and then they can link to urgent services. So it's a really helpful resource to have available for families that may need it. The Suicide Prevention app, it's an app on the phone that allows you to enter contacts that then send alerts when they feel like they're not okay. So again, they've got those safe contacts, and we want these, obviously, they're more likely to use friends, but if they have another adult that they can enter into, that adult can actually act on it and really work to make sure that child's okay. But it's, again, just another lifeline for kids. And then Child Help runs a live chat function via a chat line, and they do texting. So kids who want to report or disclose abuse, but it may not be safe to make a call, they can do it via text or chat. So those, again, are options. Child Help really stepped up during the pandemic. They took a lot of calls from kids wanting to report abuse, and they work then to get those reports made to the appropriate authorities, get kids connected to help when they can. Another number that we really want to emphasize is the 1-800-CHILDREN. This is the PCA Georgia helpline. It's a warm referral source, so people can get a wide variety of resources, information on a wide variety of resources, and then get connected. So, caregiver support, what community programs are available, what kind of after-school programs are available. All of these kinds of things are reasons people call. Then they offer those resources, connection to those resources and information about that. They, have got a huge number of resources loaded into this service. You can also access it online, but it really helps recognize that sometimes the family just needs resources. They're overwhelmed. They need to know what's available in their community, and reaching out and making that connection with somebody. And you're actually talking to a physical human being. And it's not an automated system where you're having to press one multiple times. Talking to somebody who can actually ask questions and really discern what you may need. So it's important. We just want to take a minute to really recognize, as you're doing this work, as you are thinking about this is hard. We're all still in the midst of a pandemic that's just ongoing. So it's important that we're aware of how we're feeling, and that we're patient with ourselves, we're patient with our coworkers, we're patient with our kids, and really help our kids know that it's okay to be frustrated. It's okay to get upset. We want to help you through that. We want to help you figure out how to move to the next step. And then just some really simple things you can do. Take a pause. If you can, take an afternoon off. If you take a day off. Sometimes it's just, can you go someplace by yourself for 5 minutes and breathe deeply and then respond? You're really giving yourself a chance to pause, breathe, and think about your response, and then respond. It gets back to sometimes those coworker interactions, that it's really the stress of everything we're dealing with can impact how we respond to people. So it's just a little bit of a reminder about mindfulness and sort of being aware of how we're responding to things. Because as we model that for our kids, as we model that for our coworkers and for other people in our environment, it really begins to spread. And you're really then helping have more people who are ready then to meet the needs of our families. So one thing to remember, the most important factor in helping kids overcome adversity is the presence of just one caring adult. So the fact that you're at this conference means that you care about kids and families and you really want to help them. So, how we build that supportive village means we have multiple caring adults. And so how do we leverage those adults into helping our families diversify their village? But it's important that we recognize the important role we can play by being that caring adult. Then we'll open it up if there are any questions in the chat. We did leave our contact information for you. If you have additional questions, if you want more information, please feel free to reach out. I know Cheryl would echo that.
Absolutely. And I updated the webinar link. Apologies that the first one appeared to be incorrect. So the right one is there.
Okay. I'm Jill, are there any questions?
Yeah, I'm looking in there now. We have lots and lots of comments in there and just people wanting to share their resources and well for the area. If anyone has any questions, go ahead and put it in the chat box now or in the Q&A one as well. And I just wanted to reiterate, these slides will be on the Cadence platform. They're also already on our conference website, and the recording will be on our conference website as well, along with a lot of the links that we had posted. Can you reshare the link that kids make their own report? Yeah, that is the, let me pull it up. Child find,
It's child help. Hold on.
Child help, yeah, I got it.
You got it?
Yeah. So child help is the one where kids across the nation can text, it's a chat, phone, a lot of different options for them to go and seek help themselves. We always believe that adults should be the one to advocate and protect for children. but we know not every child feels comfortable or is in that situation. So that's a great one to post for youth to reach out themselves.
And Jill, I saw a question asking how can you know if your school is taking advantage of the resources offered to them? The best way is to start a conversation. It may be that they are and it's just not publicized. It may be that there are resources that haven't gotten to a school, right? So sometimes an email may go to someone at the district level and it may get stuck, for lack of a better term, and doesn't trickle down to where it should be. So if I send an email to school superintendents, the school counselor may not see that email necessarily. And we really try to make sure it gets to the people who need to see it. But as a former school administrator, it was never a problem for me if someone came in and said, hey, I saw this webinar and there's this really cool thing happening somewhere else, or the DOE said this or that. And do y'all know about this? That should be a good conversation starter. And a lot of times that can really help build a partnership with a school if you're coming to them and offering, information about a resource that may have, for whatever reason, not been brought to their attention, or it just wasn't applicable at the time, but now it is relevant. So there's a lot of good ways to find out if schools are doing something that you're interested in and to get back to it.
Thank you, Cheryl. We're still.
They're asking if you can make the child help a link.
Yeah, I just put it at the very bottom of the chat box, but it's also on our conference website. And I put it on this presentation, the scheduled presentation within the Cadence platform. All of it is linked there as well for you guys to go pick up that. This is the most fleeting one in here, but we have a couple places where it will be more permanently for our conference guests. I want to go ahead and just really thank Angie and Cheryl for you guys' time and expertise today and presenting all these great resources, and for all the participants who really shared along with all of their community resources and we're super engaged. So thank you guys so much. We have a networking session coming up at 11:45 a.m. if you wish to attend. If not, this is kind of like the midday lunch break, and we hope to see everyone back at 12:30 sharp. We are going to announce some of our first winners and have the first keynote address. So thank you, everyone. Have a great one.